Today we'll discuss about root canal treatment for a dentist. Right now I'm talking about. So the root canal treatment starts with excess opening. So it comes into three parts. The first part is complete decay removal. So complete decay removal is very important part for starting the root canal treatment. Since we will discuss further plan if the tooth will go for post and core treatment, or if it is not possible, if the decay is reached till the roots, then we have to extract the tooth sometimes. So, and the second part will be the complete deroofing of the pulp chamber. So complete deroofing of pulp chamber is important because if any there if at all there is any pulp remnant, dead pulp remnant will be there, it will further cause pain or infection in the tooth. So the third part in excess opening is glide path. Glide path, we are discussing about the glide path. So right now glide path is when we are putting a file inside the canal, it should not have any hindrance from any walls, because if there is any hindrance and the file is tilted, then it can cause it can form a ledge inside the canal, which will hinder with your root canal treatment. Now we'll talk about BMP, biomechanical preparation. So we'll discuss BMP. Right now I'm discussing in the way of conventional plus pro tapers, hand pro taper we'll discuss. So the first part will be the working length. So the working length we will take with the help of radiographs or apex locators. Apex locator, they come in various generations. So we'll discuss that later on. The radiograph working length will take the working length with radiograph with the help of 10 or 15 or 20 number files. Okay. Then root canal cleaning and shaping. The second part will be this. Second part will be the root canal cleaning and shaping. So after taking the working length from 10 or 15 number file, we will use the 10 or 15 number file also with the EDTA, and cleaning and shaping will be done. Then after 15 number file we will go till 20K file, and 20K file will be the last K file. Then we will go for the then we will go to pro taper. So first pro taper we will use will be the SX. SX is already known as orifice opener, and we will do till the master apical file. The master apical file will be the file which will the last file we are going to use on each and every canal. Okay, so the master file depend upon the width diameter of the canal. That will be the irrigation. In irrigation, after putting every file, we have to irrigate it completely. And the fourth part will be the recapitulation. So the recapitulation is whatever will be your last K file, we will use it for recapitulation. Recapitulation is used to remove all the debris from the canal after preparing the canal with a newer file. So like if I am using S1 right now, I will recapitulate it with 20 number K file. Then again I will go for I'll irrigate it, and then I will go for the S2 file. Then I will recapitulate it with 20 number K file, and then I will go for further on, like this will go. So the final part of root canal treatment is obturation. Whichever will be your master file, whether it is S2 or F1, we will put a GP of S2 or F1 inside the canal. So the first thing we have to do is dry the canal, apply adequate amount of root canal sealer, RC sealer, then put it on the GP and we'll put it in the canal. Then we'll check with the radiograph before going any further. So we'll check with the radiograph. If it is showed, then we have to prepare that canal again from initial file to maintain the working length. And if it is beyond the beyond apex, beyond apical foramen, then we will cut that part, that much of GP, and then again we will put the GP in, GP inside the canal, and we'll check with the X-ray. If it is till the apex, then we'll cut the excess GP from above, and then we'll seal it with heat.